Hello, I'm Dr. Melita Tate with Grassroots Healthcare. We're coming to you from our office at 91st and Sheridan. We're located 6530 East 91st Street, just down from Economy Pharmacy. We have a special guest here today. This is Chris Schiller, the pharmacist from Economy. It's good to have you here.
Thanks for having me.
Yeah, great. So we have a great show prepared for you today. We're going to talk about hormones and some supplements and things that Economy Pharmacy is special because they compound medications, meaning that, well, we'll get into that, but I'm going to ask him to explain to you exactly what that means. But we're going to talk today about a little bit about hormones. We're going to talk about some special supplements and different vitamins and things that they can get to you in a way that your body's maybe more able to absorb, or to get your levels up a little bit more quickly, or sometimes just ways that we can do things more affordably than some of the other methods, especially for our patients who are cash pay patients. For those of you who've never seen our broadcast before, Grassroots Healthcare is a clinic that tries to be as free as possible from the influence of insurance and government. We don't take Medicare, Medicaid, or any kind of insurance here. Everything is just cash pay. But if you do have insurance, we do have a lab that'll do your blood on your insurance and those kind of things. So we still take insured patients, but we care about you, not your insurance. So we're not spending a lot of time pushing your insurance dollars around. Now, Economy Pharmacy does take insurance. So they take insurance or cash pay, and they've been so great to work with us and with our cash pay patients, and we've appreciated them so much. Now, last week we had one of their competitors. We had Jen Scripts on here too, but these are our two go-to pharmacies because they've just been so helpful to our patients who are without insurance or who have high deductible insurance and so have to pay a lot of out-of-pocket costs for their medications and for their care and for their lab and stuff. So they've just been an asset to us that's unbelievable, and to our patients, and so our patients really appreciate them. And one of the unique places that they fit in is helping us compound medications for patients who need to absorb hormones, and we're very much at Grassroots Healthcare about not only saving patients money, but we're also there for health and wellness. And we try to get you off as many of the medications as we can. I know you've never probably seen a doctor and a pharmacist who try to take as few medications as we do, but we try to get our patients off medications too. We want to get our patients well. And so in that respect, we try to supplement you with things that your body's actually deficient on. So if you're deficient on a hormone, we'd rather give you that than some other medication that's going to numb your brain to the effects that you're feeling from being deficient on the hormone, like an antidepressant. So if there's something we can do along those lines, that's what we're here for. And so with that, and the fact that, you know, this clinic is geared towards trying to help you find alternative ways to care for your health, we've brought Economy Pharmacy in here, and they're going to, why don't you start by telling us where you're located and what you do.
Well, thank you for having us today. Like Dr. Tate said, Economy Pharmacies, we're different than other pharmacies. We do everything. We have regular prescriptions, take insurance, take cash patients. We do compounding, we have supplements, everything that you need. We actually have 4 locations, 2 of them here in Tulsa, one at 91st and Highway 169, the other one in the William Building by St. Francis Hospital, and we have 2 locations in Muskogee.
Mm-hmm. Okay, and so tell me what's different about a compounding pharmacy compared to just a regular pharmacy.
Okay. So compounding pharmacy, what we can do is, let's say the doctor writes you a prescription and the strength that is right for you is not available commercially. Like they make a 100 milligram or a 500 milligram, and for some reason you need like a 175 milligram. And what we can do is we can actually compound specifically based on what the patient needs. We can compound a specific dose just for you. And we do creams, gels, ointments, capsules, rapid dissolve tablets, suppositories, liquids, troches. We can do just about anything.
Mm-hmm. So this comes into play a big part for our patients who are on hormones, and we're going to talk a little bit about that. But one of the exciting things about why and how they do that is a lot of the medications that we always take as a pill are absorbed through our intestines, and then those blood vessels go straight to our liver first. And then the liver processes the medications that we've taken in and then deliver it to our body. And so the medications get altered while they're in our liver. It's called the first pass effect. And we can eliminate that and get the medication, especially if it's in a more pure form, by absorbing it through our, and correct me if I get any of this wrong, okay?
Nope,
I'm not a pharmacist,
you're good so far.
He's going to keep an eye on me. But when we absorb it either through our mucous membranes between our cheek and our gum or through our skin, then we can get the medicine more quickly delivered into our system, almost like an IV medicine would be, and it can be not metabolized already by the liver and a lot of it broken down and already set for elimination or inactivated. And that's a good thing. And I want to bring that up today because we use bioidentical hormones here. And this is a very controversial subject between a lot of physicians, mainly because we're ignorant about it. We haven't studied it. We weren't taught about it in medical school. And again, there's a good reason for this. These medications are, we use the word bioidentical. They match what our hormones look like a little more closely. For instance, if I measure a patient's blood levels who's on a birth control pill, we see their estrogen levels and their progesterone levels be non-existent, basically. It suppresses them. But if I measure a patient who we put on, and these don't work like birth control, but these are hormones. If I put a patient on a bioidentical progesterone or an estradiol, then we'll measure their levels in their bloodstream and we'll be able to see a change based on the cream or the troche or whatever they're using to get it into their system. Mm-hmm. So can you give me a little bit of an idea how the bioidentical hormones, they're not truly bioidentical, well, but they're...
Yeah, so the way it works is that, yes, they're not human hormones broken down and then re-given to you, but what they are is they're actually derived either from yam or soy, and then they're chemically altered to be identical to what your body makes. So for years there have been commercially available synthetic hormone replacements, so such as Premarin or Provera. And the thing about those is, yes, you're going to get some relief from some symptoms, but it's a huge chemical compound that doesn't match what your body makes. So your body doesn't really know what to do with all that extra stuff. It might relieve your hot flashes, but the long-term side effects of being on that can be very harmful, as proven in many studies. Right. The thing about bioidentical hormone replacement is we're taking a plant, chemically altering it to be identical to what your body makes. So if the key needs to fit into the lock, it's going to fit exactly right.
No extra side chain.
That's right. No extra side chain. So your body is going to know how to metabolize it, how to use it, where it needs to go in the body.
Perfect. Yeah. And because it's made from a plant, soy or yams, mm-hmm. as you mentioned, because it's made from a plant, it's not at this point regulated by the FDA. Is that correct?
That's right, and it's a naturally occurring thing. So there are actually some bioidentical hormones that are commercially available, such as estradiol. Estradiol tablets are commercially available. The thing is, you wouldn't want to be on just an estradiol tablet. You would always want to have it balanced out with some sort of natural progesterone. There is a progesterone that's actually available commercially, and it's called Prometrium, and there's two different strengths. There are only two different strengths, 100 or 200 milligram. It's also is made out of peanut oil. So anyone allergic to any type of nuts or peanuts can't take it. And so what we can do is combine those into one, which is a cost-saving thing also, and provide that balance of that estrogen with progesterone mm-hmm. in a safe manner and a customizable dose. So you really might need 137.5 milligrams of progesterone, and we can make that into a cream or a capsule or a troche, whatever you need. And we use, and Dr. Tate mentioned the first pass effect, and sometimes we use that to our advantage. There's a certain hormone such as progesterone that we will actually on purpose sometimes give a capsule, a progesterone capsule, because your body breaks it down. And one of the metabolites will actually help you sleep, actually help you relax. And so sometimes we'll use that to our advantage. When we're trying to help someone sleep or relax, we'll do a progesterone, capsule by mouth. But most of basically all of the other hormones need to be done transdermally or transmucosally for best effects.
This is so exciting to me because we have something now that we can give our patients that's natural. It's less cost because it can't be marketed and packaged and put into a drug that's been through, whatever rigmarole they put it through to make it more expensive for people to. And so They can't make this where you can't afford it because it's basically natural and a plant-based substance. So that's really exciting. The other very, very exciting thing about this, because you may be sitting there going, well, I don't need hormones. So, and I should have addressed this from the very beginning, but the other exciting thing about these plant-based hormones is the synthetic hormones that we've been using all these years, the ones that were used in the big trials that we stopped giving everybody their estrogen, women were having hot flashes everywhere. It was like terrible craziness because of the heart damage that they were having from being on estrogen, or the risk of heart damage from being on the estrogen pills. That was done on a synthetic, those studies were done on a synthetic that acted on the estrogen 1 receptor. Now we know that there are estrogen 1, 2, and 3 receptors, and there's multiple receptors for these hormones. And some of the estrogen 2 and 3 receptors are activated and are touched on by these plant-based hormones because they are matching exactly in chemical composition to what our body would make. Even though they're not made from humans, they're made from plants, they still have this exact same side chains and everything matches. That's why they're called bioidentical. And so they act on the estrogen 2 and 3 receptors, whereas the original test studies that everyone got so bothered about were acting on the estrogen 1 receptors. And so the estrogen 2 and 3 receptors have a lot of protective mechanisms. So if you think you don't need hormones because you've already gone through menopause, or you just want your body to be natural, there's some things to consider. For one, your bone strength is a very important thing, and we know that estrogen and testosterone help prevent frailty as we age. Now, back in pioneer days, it would be fine if you wanted to get old naturally and die, you know, at a ripe old age of 55 if your bones deteriorated. But these days, people are living to their 80s, 90s, and even older, and we don't want those patients to be frail and to suffer from hip fractures and things like that. So not only does the estrogen help, we've also seen that it helps protect against some ways. It helps protect against dementia and frailty of the brain and deterioration of our cells. It keeps us young. And so not just it's not just for your sex drive or things like that. It's also to help protect your aging process, and so that you'll be strong and vital and healthy. So there's a lot of good reasons to consider them. One of the most exciting reasons that I saw whenever I was doing the study, and we went to lectures on these in the beginning, was that the patients who have been on progesterone, say, or who needed progesterone, we start declining in progesterone early, around age like 25, 35, it just depends. Some patients are deficient on it even earlier. But it's one of the main reasons why young women wind up in the emergency room for panic attacks. You start having anxiety, you start sleeping less at night. It's one of the big reasons why women have insomnia too, or not sleeping well at night. And so when we check people's progesterone levels, a lot of times we'll find that they're low, and we'll supplement them with progesterone, and they'll start sleeping again, and a lot of their anxiety, irritability will go away. How much better is it to put a patient on progesterone than to put them on some form of something that just numbs their brain and makes them, if they're deficient of a hormone, then they need to be supplemented with that hormone or find a way to wake that hormone up. So along with treating with progesterone, then we try to find other ways to do that. So there's a lot of reasons that you would want to think about whether or not you may need hormonal therapy. And so we have some of those here. We have our patients fill out, you know, their history forms. You can kind of see those here. They'll come in and circle which symptoms that they're having. Some of those would be weight gain, irregular menstrual periods, hot flashes, breast tenderness, dry skin, hair, mood swings, sleep disturbances, night sweats, and fatigue, hair loss, headaches, cramps. There's just a whole lot of symptoms that we look at. We also have one for the men, for male testosterone, and a lot of them have to do with mood changes, anxiety, depression, and there's just a lot of interesting things if they're gaining more weight around their pant size, those kind of things. So that's what our main thrust and our main relationship with economy comes from the hormone therapy that we refer to them, because nobody else can make, no regular pharmacy can make that kind of a compound. There are other compounding pharmacies. Economy has been very good to our patients and has made it very affordable for our cash pay patients. And so we really appreciate what you've done for them. And so many of our patients are on those.
Yeah.
Yeah.
I brought some of the ways that we dispense some of the hormone, depending on how you order it. So if you were to get a prescription for the progesterone capsules to help you sleep, to help you relax, just come in a regular bottle, regular capsules. We actually compound these capsules specifically to whatever strength that is ordered. So if she orders 25 milligram, there's going to be 25 milligrams in there. If she orders 50, there's going to be 50 in there. So it's just a regular once an evening capsule. So you'll take that every night. I try to tell them around dinner time, but at least by bedtime is how that's normally taken. And then if doctor was if she would order you a cream or a gel, if it's a male testosterone replacement in a gel form, it would be a blue pump, not a pink one. But 2 pumps is 1 dose, and it will tell you that on the label. So basically just 2 pumps. We're going to alter the site of application. If you're a male and testosterone replacement, we usually do the shoulders. Usually 1 shoulder one day, 2 pumps, 1 shoulder the next, up and down the arms, anything like that. If it is
that's a gel?
That would be a gel. Yeah, what we do is we actually use a base called lipoderm for all of our male testosterone replacements. We call it a gel. It could be called a cream or a gel. It's a creamy gel.
Gel's more manly.
But, yeah, but men don't rub on cream, but we're okay with rubbing on gel. If it's a female, it would be a cream, and 2 pumps is still 1 dose, and you alternate sides. Basically, up and down the arms, and then on the inner thighs is the normal applications places for those. And I always recommend that you alter sites and wash your hands afterwards, because anything that you touch afterwards, you'll be giving hormone to. So that's real important. And then one of the kind of the newer thing that Dr. Tate's been doing, that we've been doing more and more, is called a troche. And so basically what we do is we make little hard pieces of candy. And you basically just park it right there, and it's just absorbed transmucosally. And this can have a variety of different hormones in there. We do flavor them. We try to make them something that people will enjoy. We usually do like a mint flavor or spearmint, something like that.
I've ordered the mint, and most of my patients like it, but a few of them have been taken issue with how strong the mint was. So.
Well, for the first few days, yeah, it's not bad. But after a few months of being on the same flavor, sometimes you can get a little tired of it, especially if you didn't like it very much. So you can always let us know. We can always try a different flavor. But we call this a troche.
And so one of the reasons I alternated them, and you can tell me about this, is that we'd had some patients with one that maybe they weren't absorbing it as well, and that could have been because we needed to tell them to alternate sites more. Or...
Yeah, some patients just don't absorb the cream or the gel like they should. It could be difference in skin thickness, application site, body fat composition. A bunch of different factors could affect the absorption of the cream. So we started doing these troches, and I think we've seen good success with
we'll see an improvement in their levels after, if I know that they're absorbing some, because the progesterone level will go up, but their estrogen isn't. And so then I'm like, well, that's weird. So then I'll switch them, and then they'll both go up. So then I know that they're going up. So we do monitor your levels frequently when you're on these, about every 3 months. And or sooner, if you're having problems, but it takes your body time to get adjusted to a different hormone regimen. So So
I usually tell the patients 4 to 6 weeks before that new dose becomes steady state in their system. So they're going to be getting a dose every day, but it takes 4 to 6 weeks to become to where that dose is going to stay the same every day.
Perfect. Okay. So we wanted to talk a little bit too about some of the other things that Economy Pharmacy offers to our patients. One of the things that we have you guys fill frequently is your magnesium glycinate. Can you talk a little bit about that?
Yeah, magnesium is, just like you might have family members or you are low in potassium, low in this, low in that. Magnesium is very important to the body, for the body's natural function to do what it should, and we don't, as Americans, get the right amount of supplements or vitamins in our diet that we should. And so magnesium is one that is very important, that usually is ignored a lot of the times. And if it is taken, it's usually people will just go to the grocery store or the big pharmacy and just buy whatever magnesium's on the shelf, which is magnesium oxide. And that's a fine product to help replace some magnesium, but there are different forms of magnesium. The one that we prefer is called magnesium glycinate. And what it does, and the reason we sell it the most, is it helps with sleep. It will help you, it helps give your body the nutrients that it needs to get to sleep and want to sleep, get into a deeper sleep and stay asleep longer. And so we actually started marketing this product as Sleepies. We would make it as Sleepies, but now we do that. Or if it's something you're gonna be on long term, then we just fill it with magnesium glycinate, and it's 600 milligrams of magnesium glycinate, and it can make a big difference.
Yeah, we use it for patients who have a lot of anxiety or heart palpitations. A lot of times if we start a patient on thyroid medication and they're having heart palpitations or something, we'll have them back off of that, make sure that their magnesium levels are good, and then add it. But we also use it to help with blood pressure control, kind of to augment blood pressure control on some of our patients. And then mostly we use it for our women who are having trouble sleeping. Not always do you get a low magnesium level in your bloodstream, and even when you do, magnesium is very key in helping you get products across your cell membrane. And so even if your bloodstream has great levels, sometimes you don't always have, your body can leach calcium out of your blood or out of your bones to keep your blood levels normal. Same thing with magnesium. And so you may have a normal blood level, but still need magnesium supplements. So we like to give it so that patients can use what they need and get rid of what they don't. We don't want to be overdosing anybody on magnesium, but at the same time, we try to treat their symptoms and see if they improve. If they do improve on the medication, then we think that, maybe we don't have a great way of testing for it, and we may keep them on that for longer and see how they do. So. Some of the other supplements that are available there that we send our patients there frequently for, and please, they have every prescription that you would think of, that they have them there. These are just the things that we tend to use them a lot for, but they carry just all of your regular basic prescriptions as well, and they try to carry them at a very competitive cost. So, right?
Yes, we do. And if you are an insurance patient, it's going to be the same copayment at our pharmacy as it is at wherever you've been going. And insurance kind of levels the playing field when it comes to that. But if you're a cash patient, what we have is a in-house discount card program, and that really will save you a lot of money, very competitively priced. We also do, we were going to talk about vitamin D. We also do vitamin D, which can be either prescribed by your doctor, vitamin D in the 50,000 unit once a week. It's also available over the counter in what's called vitamin D3, which is available in quite a few different dosages. There's usually 2,000 or 5,000 a day, or there's a 50,000 units one that's a once a week. There's also micellized, which is a liquefied vitamin D3.
So when we see you in here, if you're having lots of aches and pains, or if you're having mood disorder, one of the big things recently has been for the psychiatrist to start checking vitamin D levels and seeing that mood disorder, vitamin D plays a big role in that. So we'll check your vitamin D levels. If it's in normal's 30 to 100, if it's running in the low normal, or if it's 30, we'll supplement you up into the upper third of normal, see if any of your aches and pains go away, see how your mood is, those kind of things. We check your levels, so we'll supplement you with the 50,000 units once a week for 8 to 12 weeks, depending on how low you are. I had 2 come across my desk today. Both of them were low. One was 12, one was 30, so it was still considered normal, but low. So we'll supplement those for 8 to 12 weeks, and then we'll have you retest, see where your vitamin D level is. Then we'll pick a dose for you to take daily based on how much you've come up just with that supplement. And so then we'll send you to Economy to get your daily vitamin D doses and what have you. The other thing that we like to use a little bit of here for mood is one of the newer things that they've been testing for on our patients with insurance. The lab will test for a genetic condition where your genes, you may be homozygous, meaning you have both genes that don't allow you to process your folate correctly. And so some patients, instead of just taking folate, because their folate levels will be fine, but they're not processing it to the methylfolate, is to take methylfolate. And so we've been good at being able to get to Economy to have those made as well. So, and that helps with a lot of dementia, psychiatric disorders. It has to do with cardiovascular events, and also with just mood disorder. And so patients who have a lot of family history of bipolar disorder, or just a lot of depression in the family, a lot of times what we're finding is that they're carriers of this genetic tendency to not be able to process their folate correctly. So I did want to make a quick comment before we wind up here, that if anyone has questions or comments, if you go down to the bottom of your Facebook screen there, and if you click on the comment section, you can make comments or ask questions, and we'll try to address some of those more when we come back next week or maybe today.
I've got a question.
Yes.
Okay. We've seen in the last year or so a real big increase in the vitamin D prescriptions. Do you think it's as a result of a study that came out, or do you think it's a result of just a deficiency all of a sudden, or do you think it's something that's been there for a long time that we haven't been addressing?
I think it's been there for a long time and we haven't been addressing it, but I also think people are getting more aware and starting to test for it. I did see a study came out recently, and I'm not sure, there may be a study that I'm missing. So if any of the chiropractor friends I have out there or someone else knows something different, please get that information to me so I can get it out to the patients. But one of the studies I saw that really interested me was that when you have aches and pains and you can't find where they are, they took a number of these kind of patients and tested their vitamin D level, and 90% of them were vitamin D deficient. So I've had young people come through here that have had just generalized, muscle aches and pains that didn't really have a reason for it. They didn't have a back issue or whatever. So we'd check their vitamin D level, we'd supplement their vitamin D, and their aches and pains would go away. So we've had good success with treating the vitamin D levels. So, and I wonder too, we're not absorbing as much of it because we're wearing sunscreen all summer. Mm-hmm. I mean, we don't want to get skin cancer, but sometimes we fix one problem and make 5 more. So,
Okay.
But there's lots of nutritional sources of vitamin D too. And one of the things we like to do at Grassroots is talk about nutritional things that you can come in and do to increase your vitamin D levels. Mushrooms, shiitake mushrooms are a good one for vitamin D, especially if they've been dried in the sun. One of the exciting things I put on my Facebook last week, I don't know why these things get to me, but they just make me so excited that you can get these shiitake mushrooms. You can grow your own mushrooms if you want to, whatever. I'm not telling you how to do that. There's websites you can learn about that stuff. But the shiitake mushrooms, if you take them and you put them outdoors and let them dry in the sun, it increases their vitamin D levels from 2,000 units all the way up to 10,000. And if you turn them upside down and let their gills soak up the sun, it increases their vitamin D levels to 20,000 units. So I just thought that was so exciting. So there's lots of nutritional ways too for us to take care of ourselves, and we want to learn. And I'm learning every week new things like that, to not only give patients a prescription of vitamin D, but actually empower us to nutritionally take care of our own selves and get kind of closer to the earth and figure out ways that we can do things for ourselves where we don't have to be on pills all the time, which is what my patients want, is to get off of them. And so if the vitamin D levels make your muscles and aches and pains feel better, when we get those up and you come off of anything else that you're treating for arthritis, great. We love that. We want that for you. So let me think if there's anything else. Is there anything else you wanted to tell them about your pharmacy?
No, the only thing I was going to say about the hormone replacement and the things Dr. Tate's talking about is we want to get to the root cause of your symptoms or what's happening, not just treat your symptoms. So if you're depressed or you got some water retention or you're foggy thinking, we want to get to the root cause of that, not just slap you on an antidepressant or do this or that. We want to get to the root cause of it and to actually prevent that from happening. Actually treat the problem, not the symptom.
Right, exactly. Yeah, thank you for bringing that up. The root of all evil. Is that what the title of this thing was supposed to be about? And yeah, that's absolutely right. And so we don't want to put you on a medicine that's going to make you gain weight. Some of the antidepressants can for some patients, not all of them. I'm not here to tell you that all medications are bad. We use those medicines if we have to.
Yeah.
So.
And they have a role, but our prevention is number one. If we can prevent the things from happening, it would be ideal. But if they're going to happen, we want to get to the root cause of the problem and fix that, so then we don't have to cover up stuff.
Exactly. Great. I love it. And speaking of that, they do have at Economy some of the precursors to making the hormones, the DHEA and some of the other things. And so a lot of times we'll test you, especially if you have insurance and can afford it, because some of those tests are expensive. We're getting some new tests here that are saliva tests that we can do to check for some of the precursor hormones. And so we may be using more of the DHEA in the future. So we'll get together about that and see what we can do for our patients. So thank you so much for coming. Tell us again where you're located.
Economy Pharmacy, 4 locations, 2 in Tulsa, 91st and Highway 169. the William Building by St. Francis, and then the 2 in Muskogee.
Yeah. And is there a number that patients can call if they have questions?
The main one up here in Tulsa is the 91st Street is 918-615-3388.
And so I have a lot of patients who are come from out of town, Bartlesville, Owasso, places like that, and I never know where to tell them to get their prescriptions. So I've told them that you guys do like send prescriptions. You do mail order.
Yeah, we deliver locally.
Also,
and we do also mail order. And what we'll do on patients that if it's going to be a monthly thing, we can set them up on an automatic. They don't have to think about it to get sent to them.
Really?
Yeah. If you have any specific pharmacy questions or whatever, feel free to email me. It's Chris, CHRS, @economypharmacy.com.
Great. Thank you so much for coming. And so, ladies and gentlemen, Chris Schiller from Economy Pharmacy. If you guys go in there, you'll probably see him back there and just wave to him and say hi. Let him know you're from Grassroots. All right. So if any of you, if this interests you or any of your family members, you can watch this web broadcast later. You can certainly chime in, add further comments if you have them or questions on here, and we'll try to address them on our Facebook page throughout the day and through this next week. And then if there's anything I can do to help you get set up to check you for your hormone levels or any of those things, or any of your family members, please be glad to send them by. We'd love to see you at Grassroots Healthcare. 918-878-7733. We're located at 91st and Sheridan, and we'd love to take care of you. So thank you for coming.
Thanks.
All right.